Hi, good evening, and welcome back to this series of most frequently asked long essays in university exam. My apologies for starting a little bit late today. Uh, I have taken one more important question from the head and neck region today. We'll try to wind up the head and neck region today and try start discussing few more topics starting from coming weeks. But this is one very important chapter that one important long essay that we should discuss. That is the topic of thyroid gland, right? Parotid gland, thyroid gland, extraocular muscles, then infratemporal region, then larynx, tongue, soft palate. These are examiner favorites, right? Thyroid is not only important for your theory exam, it's also important for your practical exam as well for a discussion topic or OSPE topic, right? So what we'll do today is we'll try and solve if thyroid is asked as a long essay, how to go about it. And I have picked a question which was asked in previous RGUHS exam as a 10 marker question or a long essay. So I've given that with the marks division. So the question was slightly different. That's why I've taken it. Let's read the question first. The question says, describe the thyroid gland under following headings. Okay. And take a look at the headings. It has parts, capsule, relations, blood supply. The last question is a little bit interesting. This is a question that is asked very frequently in viva, but this was asked in theory exam. Anatomical basis for movement of the thyroid in the anterior midline with swallowing or with deglutition, right? If this is asked, how to write. So this is what we'll discuss. And the marks distribution is for parts, they're given 1. Then for capsule, they've given 2. So we need to elaborate a little bit. Relations, we need to write much more in detail. Then we need to talk about the blood supply, including arterial and venous. And lastly, the anatomical basis for movement, that is asked for 2 marks. So that is also quite important. So let's try and solve this question. The first thing, even though this is not asked, it's very apt to begin with. What exactly is thyroid gland, right? So thyroid gland, as we know, is the largest endocrine gland, correct? This is the first line you can actually start with. Thyroid gland is the largest endocrine gland, and then you can go on describing everything else. The next question was about parts, right? And parts was for 2 marks. Parts and relations. Okay, capsule. Yeah, sorry. We had a brief disconnect. Sorry for that. So, what we would write about the lateral lobe. Okay, lateral lobes actually make the appearance of the butterfly shaped wing of the thyroid gland, whereas the central body is represented by the isthmus. Remember, the lateral lobes, this will extend from C5 to T1 vertebra, whereas the isthmus, now this isthmus is located against the third, fourth, and fifth tracheal rings, right? This is one thing that we can write, but we will talk about the detailed relations a little bit later. Done? Now, the next part is about capsule, which was given 2 marks. Thyroid gland has a true capsule and a false capsule. The first thing is how this is formed should be written. True capsule is formed by Let's write. This is the condensation of the connective tissue of the gland. So connective tissue capsule of the gland condenses to form the true capsule, whereas false capsule is formed by splitting off an important fascia, which is called as the pretracheal fascia. Now, this you must highlight so that the examiner will actually catch this pretracheal fascia. Now, let's try to draw a simple diagrammatic representation of the capsule. Let's imagine this is the outline of the thyroid gland, right? The thyroid gland is covered by, let's say, the first one, which is the true capsule. Let's imagine this is the true capsule. So we will label it as true capsule. Surrounding this, let's imagine there is a false capsule. Done. So let's label this as the false capsule. Now, one important thing here is deep to the true capsule, there lies a connective tissue, a venous plexus. The venous trunk will traverse through the capsule and they will form a plexus deep to the true capsule. So, this has a relevance during removal during thyroidectomy. Whenever thyroidectomy is done, remember the thyroid gland, right? Thyroid gland is removed along with true capsule, right? You separate the false capsule and the true capsule. You take out the thyroid gland with true capsule. Why you do this? This is in order to avoid bleeding, right? So you want to prevent bleeding. When you try to separate the true capsule from the thyroid gland, this venous plexus can bleed, so you don't touch it. This is exactly opposite in case of prostate. Now, this is an examiner favorite question. Okay, what they ask is, how is this different from prostate? So remember, in case of prostate, the venous plexus is present right here between the true capsule and the false capsule. So what they do is, they take out the prostate gland, they leave the true capsule and the false capsule behind. In thyroidectomy, they remove the true capsule and leave only the false capsule. In prostatectomy, they keep true capsule and then false capsule and then remove the gland. This is a very peculiar relation and which has got clinical importance. And as I said, this is often asked in your viva, right? So this reason or anatomical basis behind leaving the false capsule and taking the thyroid with true capsule, you must know. Done? Right. So 2 marks if you write this. This is done. Then the next thing is regarding relations. Now, most often the students actually make a mistake of writing the relations of the lobes and usually forget about the lobes. So let's start about the relations of the lobes to begin with. Remember, the lobes will have an apex, they will have a base, they will have 3 surfaces, they will have 2 borders. Done? And then comes isthmus. What about isthmus? Isthmus has 2 surfaces and then it has 2 borders. So what are the 3 surfaces? The 3 surfaces of the lobe are superficial, then we have medial, and then we have posterior lateral. 2 borders include anterior and posterior. In case of isthmus, we have 2 surfaces. The 2 surfaces include anterior and posterior. 2 borders include superior and inferior. So if you just draw the rough outline of the thyroid gland, this is how the isthmus and the lobes will look. So this is the apex, this is the base, this is the isthmus, this is its upper border, this is its lower border, right? So here we have the anterior border and similarly posteriorly we have the posterior border separating the surfaces. So first let's talk about the relations of the isthmus. Relations of the lobes. So let's begin with the apex. Now remember, apex is the uppermost part of the lobe. Uppermost part of the lateral lobe. This is the first thing you will write. Then, in order to show the relations, draw the outline of the lobe, right? And show two muscles between which this is sandwiched. Okay? So, what are these two muscles? Remember, medially we have inferior constrictor and laterally we have the sternothyroid, right? So sandwiched between these two muscles, the apex is located. What is the importance of this? Remember, thyroid swellings never extend upward. The reason for that is the apex is sandwiched between these two muscles, and this is a must expected answer. You cannot skip this. You have to write. Okay? Then, what about, sorry, what about the base? What will be right about the base? Remember, the base is related to two structures, an artery and a nerve. The nerve is recurrent laryngeal nerve, okay? And the artery that we have here, this is the inferior thyroid artery. So this is what we write for what part? Apex and the base. Done. Now what about the surfaces? So in order to understand the relations of the surfaces, we'll draw one more diagram. So this is how the transverse section of the thyroid gland will look. This is, let's say, the isthmus, and let's say this is the lobe of the thyroid, right? Medially, what we have is, we have the trachea, and behind the trachea, we have the esophagus. Done. Are we clear? Now, let's identify the surfaces. Here, we have the medial surface. This is the superficial surface, right? And what we have here, this is the posterolateral surface. What are the relations of the medial surface? Let's try to understand. The relations of the medial surface include two tubes, then we have two muscles, and then we have two nerves. Right? Now, what are the structures that are related here? So we have the trachea and the esophagus. The two muscles include the inferior constrictor and the sternohyoid, and then two nerves, the internal laryngeal and recurrent laryngeal nerves. This is a must. So examiner will often look for this: two muscles, two tubes, and two nerves. Right? Then the superficial surface. This is related to, let's imagine, we have the sternothyroid, then we have the superior belly of omohyoid, then we have one more muscle here, which is the sternocleidomastoid. Done. So these are the muscles which are attached to these are the muscles which are related to the superficial surface, right? Are we clear? So thyroid, then we have sternohyoid, and then we have one more muscle which I forgot to mention, right? So this is the sternothyroid. Here we have sternohyoid and superior belly of omohyoid. This is sternocleidomastoid. Done? Are we clear? So this is regarding the relations. Done? Then what about the relations of the posterolateral surface? Here we have something called as the carotid sheath, right? Carotid artery, then internal jugular vein, and then the vagus nerve. Now this is how you should describe the relations of surfaces. The superficial surface, sternocleidomastoid, superior belly of omohyoid, sternohyoid, and sternothyroid. Done. Then what we need to write for the medial relations? These two tubes, two muscles, two nerves. Apart from this, we can also write two cartilages as well, right? Now, what are the two cartilages we can write? So remember, here we can write cricoid and thyroid. This is how we describe the relations of the lobes of the thyroid gland. Done? Once we have done this, let's talk about the isthmus. Right? Now, what are the structures related to isthmus? Isthmus, as we said, has superior border, and then it also has something called as inferior border. Done. So if we draw the same diagram again, so let's imagine this is the lobe of the thyroid. This is the isthmus of the thyroid. So we have the superior thyroid artery, right? The superior thyroid artery of both the sides, they anastomose here. The inferior thyroid artery, they anastomose close to the two borders. Done. Superior thyroid artery and inferior thyroid artery, superior thyroid vein and inferior thyroid vein. Done. What about the anterior relations, right? So anterior surface and then posterior surface. Anterior surface is again related to strap muscles, the sternothyroid, sternohyoid, and then superior belly of omohyoid. Whereas the posterior surface is related to the third, fourth, and the fifth tracheal rings. So when we talk about relations, this is how you must describe the relations of all the parts of the thyroid. Done? Right. Next, about arterial supply. Again, best way to show arterial supply is by drawing one more diagram again. The lobes, the isthmus, right? So let's imagine we have the subclavian artery here. Done. And we have the common carotid artery, which will be divided into internal and external carotid artery. So what happens here is, from the first part, we have the thyrocervical trunk, which divides into three branches. One of the branches, the inferior thyroid artery. So inferior thyroid artery will supply the lower pole of the base, and it will form anastomosis with the opposite artery. External carotid artery will give rise to superior thyroid. This will form an anastomosis along the opposite artery along the upper border of the isthmus. So the first artery, superior thyroid artery, which is a branch of external carotid artery. The second one is inferior thyroid. This is a branch of thyrocervical trunk. The superior thyroid artery, remember, is closely related to the external laryngeal nerve, and this is related to recurrent laryngeal nerve. What happens is, the recurrent laryngeal nerve traverses along with the superior thyroid artery and diverges away close to the apex. Done. What happens with the recurrent laryngeal nerve is, the recurrent laryngeal nerve lies close to the thyroid artery, close to the thyroid gland. Now, this has a very peculiar clinical importance. So, ligation of external laryngeal nerve is done close to the apex of the thyroid gland. Why this is done? Because this is the place where the superior thyroid artery and the internal laryngeal nerve or external laryngeal nerve will diverge. External laryngeal nerve will diverge. Now, recurrent laryngeal nerve, this, remember, is ligated away from the gland, right? So, inferior thyroid artery is ligated away. Superior thyroid artery is ligated close to the apex. This is in order to prevent injury to the external laryngeal nerve and the recurrent laryngeal nerve respectively. In addition to this, we can have the third artery, which is called as arteria thyroideae ema. This usually arises as a branch of arch of aorta or the brachiocephalic trunk. This is not present in all of us. This is present only in 10% of the individuals. When present, this arises from the arch of aorta or brachiocephalic vein. Brachiocephalic trunk. Then, what about venous drainage? Remember, venous drainage again is very peculiar. We'll draw the outline of the thyroid again. Isthmus, right? Then the lobes. Of course, the major vein that we would drain, the thyroid gland is the internal jugular vein, right? So this is the internal jugular vein. The internal jugular vein, as we know, will join with the subclavian vein, and this will form the brachiocephalic trunk, right? So we have a superior thyroid vein. So let's call this as superior thyroid vein. There is this middle thyroid vein. Done. Along with this, there is one more vein, which we refer to as the inferior thyroid vein. So here, let's imagine we have the left brachiocephalic trunk formed by the union of the left subclavian and left internal jugular vein, right? And this forms the superior vena cava. So this is where the inferior thyroid vein begins. So this is the inferior thyroid vein. And where does it drain? It drains into left brachiocephalic vein, right? In addition to this, in between the middle thyroid and the inferior thyroid vein, occasionally there can be a vein called as Kocher's vein. This can drain into the internal jugular vein. And what is the name of this vein? This is called as Kocher's vein. So remember, when blood supply of the thyroid is asked, you need to mention arterial supply, and you must specifically mention about the relation to external laryngeal nerve and where the superior thyroid artery is ligated. Inferior thyroid artery, relation to recurrent laryngeal nerve, and where is it ligated. And then venous drainage, 4 veins, right? And remember, the inferior thyroid vein drains into brachiocephalic vein, does not drain into internal jugular. If you want one more additional point, right, that is the middle thyroid vein is often referred to as the widow's vein. Now, why is it called as widow's vein? There is superior thyroid vein, inferior thyroid vein. There is superior thyroid artery and inferior thyroid artery. But there is no middle thyroid artery. There is no artery accompanying middle thyroid vein. That is the reason why this vein is also referred to as widow's vein, because it traverses along. Done? Right. The last question was for 2 marks, which asked anatomical basis behind movement of the thyroid deglutition. So every time we swallow, the thyroid gland moves up with deglutition. Now, what is the reason or anatomical basis for this? Remember, there are 2 reasons. One is the attachment of pretracheal fascia, right? This most of the students again fail to explain, right? Attachment of pretracheal fascia. How? Remember, the pretracheal fascia, this will split, enclose the thyroid, right? Enclose the thyroid gland, then unites and attaches to the thyroid cartilage and the hyoid bone, right? So what happens to the pretracheal fascia is at the lower border, it splits into 2 layers, encloses the thyroid gland, unites at the upper border, then attaches to the thyroid gland and the hyoid bone. So every time we swallow, hyoid moves, right? Along with the hyoid, the thyroid gland is also moved up. One reason. The next important reason is something referred to as ligament of Berry. Now, what is this ligament of Berry? Remember, this is a modification of the pretracheal fascia. This attaches the lateral lobe of thyroid, lateral lobe of the thyroid gland to cricoid cartilage. This you must know. Most of us know what is ligament of Berry. Ligament of Berry helps in movement of the thyroid, but what exactly it is? This is the modification of the pretracheal fascia, which attaches the lateral lobe of the thyroid to the cricoid cartilage. These 2 factors. The main factor is attachment to the pretracheal fascia. The second factor is ligament of Berry. These 2 ensure that the thyroid gland moves up and down with deglutition. Are we clear? This is regarding the anatomical basis behind movement of the thyroid. As I said, if thyroid gland is asked, these are the must write points. These are the points the examiner will look for. And if you can do this, you will score at least 8 or 9. Right? If the examiner is generous enough, he might even give 10 as well. Right? But these are the points that you must never miss. Okay? I'll repeat again: thyroid, parotid, extraocular muscles, infratemporal region, tongue, palate, then even pharyngeal muscles. If you miss this, this would be a crime, right? So never ever forget to revise the topic of the thyroid. Done? So this is regarding the thyroid gland that I wanted to discuss today. Next week, we will come up with one more long essay, and hopefully we'll start discussing the long essays from the topic of the thorax and abdomen from next sessions, right? Thank you very much for joining. See you on Thursday with the slides of large intestine. Remember, we had discussed about small intestine slides. We will discuss about the large intestine slides on Thursday. Thank you.